Now, we have a special investigation of what has become a plague in our country. About 2 million Americans are hooked on prescription painkillers, and in 2012, 259 million prescriptions were written. That's one bottle for every American adult. How could that be? Jim Axelrod and producer Ashley Velli found out in West Virginia, a state that is attempting a drastic solution, allowing addicts to sue the doctors who got them hooked.
So you would spend $1,000 a week?
Right.
17 years ago, Willis Duncan's life changed forever when a coal mining accident left him with a crushed sternum and broken ribs.
If I didn't have 10 pain pills, I wouldn't go to work. Bottom line.
Changed your life?
Changed everything.
Duncan developed a lifelong addiction to painkillers when his doctor's only treatment was a never-ending supply of pills.
And the only time that you went in to see a doctor was to get your pills raised.
Hang on a second. You go in to get looked at, but the examination isn't done by a doctor?
No.
Duncan would wait for hours to be seen for just a few minutes at this clinic where 150 patients lined up every day for pain med prescriptions.
Did you ever say to a doctor, this has gotten out of hand and I need help?
Never. Because you done got used to them and you didn't know how to function without them.
This cash-only operation allowed doctors to clear as much as $100,000 a week.
We're here in Mingo County, West Virginia, executing a search warrant.
The clinic was raided and shut down in 2010.
Here's the exam room.
These are what passed for exam rooms.
Main office.
Piles of trash and files, loose prescription pads, syringes, and starving birds stuck in roach-infested cages.
That's floor set.
Hundreds of patient records were seized, along with thousands of undated and pre-signed prescriptions for addictive pain meds like Vicodin, Xanax, and Lortab.
Is that for Vicodin?
The doctor in charge went to jail for 6 months for negligence.
Just do kind of a drive-by, take a look at the place.
DEA agent Gary Newman is part of a team currently investigating dozens of doctors, pharmacies, and distributors throughout the state.
We are talking, in a certain sense, drug traffickers, and they are doing nothing but writing and cranking out prescription after prescription after prescription.
They're pushers.
They truly are.
West Virginia has the highest rate of overdose deaths in the nation. Each year, doctors write the equivalent of 1 painkiller prescription for every man, woman, and child in the state of 1.8 million. In the last year, the West Virginia Department of Health inspected 19 pain clinics. 12 were told to shut down.
You can actually be so stressed that you can't sleep at night.
One is run by Dr. Michael Kostenko, seen here lecturing patients. He's written more than 40,000 pain pill prescriptions over the last 2 years at his Coal Country Clinic. Kostenko was among those ordered to stop operating as a pain clinic, but remains open. After weeks of trying to reach Kostenko, we drove out to Coal Country Clinic, located at the end of this narrow 2-mile logging road. Instead of finding the doctor, we came face to face with a Rottweiler. Shutting down these clinics can often take years because these are licensed doctors writing legal prescriptions.
Therein lies the problem. You have to be able to prove in court that their prescribing was for a non-medical necessity or for in such an egregious amount that it was negligent.
Among the 30 West Virginians now suing their doctors and pharmacies for enabling their addiction is Willis Duncan.
They hurt a lot of people. I mean, it's just a bad deal all the way around. I have nothing for them. Nothing for none of them.
As for Dr. Kostenko, this Friday, the state begins the process of seeking to shut him down permanently, but tonight his clinic is still operating. The state could also set a precedent by going after not just the doctors and the pharmacies, but the wholesale drug distributors in court as well.
Remarkable work, Jim. Thanks very much.